Bay.
Mr. Speaker, we lost another young person in Moose Factory this week. That brings the number of over 600 young people who've killed themselves or tried to kill themselves in the northern part of my riding since 2009, and requests for suicide and depression counseling are regularly turned down by government. This week, Mushkegowuk and Anishinaabe Nation declared a state of emergency. They need action now. I'm asking the government, will they meet with the leaders, Jonathan Solomon, Isidore Day, Alvin Fiddler, and commit to a comprehensive plan to end this systemic discrimination?
Here.
Honorable Ministre du Développement Social.
Mr. Speaker, I thank the Member of Parliament for his dedication and his interest in this important topic. Our government acknowledges the scope and seriousness of the health and mental health issues faced by our Northern Ontario communities and elsewhere in Canada. Federal, provincial and First Nations partners are working strongly together to address these complex issues of mental illness and suicide, addictions, chronic disease, and improving access to quality health care needed by everyone in Canada, and in particular by our Indigenous communities.
The member for Timmins-James Bay.
Thank the member for the answer, but a nation-to-nation relationship needs a commitment from the leadership to meet. Because ever since the government of Paul Martin, everyone in Ontario has received an annual 6% increase in health transfer payments, and First Nations got nothing like that. But what they do have, the highest rheumatic fever rates in the world, Hep C, a suicide pandemic, children with parasite bacteria infections. So I'm asking this government, what commitment will they make to close that gap in the coming budget for healthcare, and why will they not meet with the leadership now and commit to ending this discrimination once and for all?
Hear.
The Minister of Social Development.
Mr. Speaker, I thank again the honourable member for his sensitivity to this very important issue. He has heard over the last few weeks and over the last few months this government's commitment to working on a renewed nation-to-nation relationship with Indigenous peoples in order to make progress on the issues that are most important to them, including health. Our government is again working with our partners everywhere in Canada, including provincial, territorial governments, to provide effective, sustainable and inclusive services for our Indigenous communities. Thank you, Mr. Speaker.